Paricalcitol, also known as Zemplar Vial, is a man-made form of vitamin D that is essential for maintaining strong bones. It is used in patients with long-term kidney disease to treat or prevent high levels of parathyroid hormone, which can lead to bone disorders. People with kidney disease are unable to produce enough of the active form of vitamin D, so they need to take paricalcitol to help control parathyroid hormone and maintain the levels of certain minerals like calcium and phosphorus. It is important to take paricalcitol as directed by your doctor, and it is usually taken by injection. The dosage and timing of the injections will be determined by your healthcare provider based on your individual needs. Before starting to use Zemplar Vial, make sure to read the patient information leaflet from your pharmacist. This medication is typically given by injection into a vein during dialysis, and it is usually administered by a healthcare professional. Your doctor will provide specific instructions, but generally, it is given 3 times a week, with a day off in between. The dosage will be determined by your doctor based on your condition, weight, lab tests, and how you respond to the treatment. In order to get the most benefit from Zemplar Vial and to prevent any potential side effects, it is crucial to follow the diet recommended by your doctor. Additionally, do not take any other supplements or vitamins, such as calcium or vitamin D, unless specifically ordered by your doctor. Always consult with your healthcare provider if you have any questions or concerns about this medication. Some side effects of Zemplar Vial may include headache, nausea, chills, or fever. If any of these effects persist or worsen, notify your doctor promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. Be sure to inform your doctor right away if you experience any serious side effects, such as constipation, drowsiness, dry mouth, muscle/bone/joint pain, metallic taste in mouth, weakness, vomiting, loss of appetite, unusual weight loss, eye pain/redness/sensitivity to light, severe runny nose, stomach/abdominal pain, dizziness, fast/irregular/pounding heartbeat, swelling in the hands/ankles/feet, severe mental/mood changes, such as agitation, confusion, easy bleeding/bruising, bloody/teary stool, or vomit that looks like coffee grounds. While very rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you experience any other effects not listed above, contact your doctor or pharmacist. In the U.S., call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. Before using Zemplar Vial, it's important to talk to your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that could cause allergic reactions. Make sure to also discuss your medical history, including any issues with high calcium or vitamin D levels, alcohol use, brain or heart problems, and liver disease. If you're planning to have surgery, let your doctor know about all the medications and products you use. It's also worth noting that this medication contains alcohol, which can make you feel dizzy or drowsy. Using marijuana can intensify these effects, so it's important to avoid activities that require alertness until you know how the medication affects you. Limit alcoholic beverages and talk to your doctor if you use marijuana. If you're pregnant, only use this medication if it's clearly needed, and discuss the risks and benefits with your doctor. It's unclear whether this medication passes into breast milk, so consult your doctor before breastfeeding. When taking Zemplar Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase your risk of experiencing serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Zemplar Vial include burosumab, products containing aluminum/magnesium, corticosteroids, calcium supplements, and other products containing vitamin D or phosphate. Additionally, inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's also essential to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Always ask your pharmacist about using those products safely. Lastly, be sure to check the labels on all your prescription and non-prescription/herbal products, such as antacids and vitamins, as they may contain calcium, phosphate, or vitamin D. Ask your pharmacist about using those products safely. If someone has taken too much Zemplar Vial and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911. Alternatively, you can contact a poison control center for guidance. In the U.S., you can reach out to your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It is crucial to act quickly in such situations to ensure the person receives the necessary medical attention. It is important to have regular lab and medical tests while using Zemplar Vial. These tests will check your blood levels of aluminum, calcium, magnesium, phosphorus, and parathyroid hormone. Make sure to keep all your medical and lab appointments, and consult your doctor for more details. Remember, it's crucial to take your Zemplar Vial as prescribed by your doctor. If you happen to miss a dose, be sure to consult with your healthcare provider for a new dosing schedule. This medication is meant to be taken regularly to ensure its effectiveness in treating your condition. Be sure to follow your doctor's instructions carefully and never adjust your dosage without consulting with them first. This medication, Zemplar Vial, is not applicable for home storage and is typically administered in a clinic. It is used in the treatment of hyperparathyroidism in patients with chronic kidney disease and in the management of hypocalcemia in patients undergoing chronic renal dialysis. The dosage and timing of administration will be determined by a healthcare professional based on the individual's condition and needs. It is important to follow their instructions carefully for the best results. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.